Good afternoon, and thank you for joining us as we advance the effort to educate, motivate, and vaccinate the entire Northwest Ohio corridor to continue to slow the spread of the COVID-19 virus. We will continue to provide the region's business community with the latest information regarding the COVID-19 vaccinations. These vaccination updates for businesses are in partnership with the Employers Association, the Toledo Regional Chamber of Commerce, the V Project, and the Toledo-Lucas County Health Department. And we were talking about this as we were logging on. They continue to be important because they are fluid as the changing landscape of the virus, the vaccination process, and restrictions are also fluid. Speaking of restrictions, over the last year, we've learned to work with an ever-changing and increased COVID-19 regulations. Following the lift on that statewide mask mandate on June 2nd, and as the vaccination rollout continues, we find ourselves as businesses once again pivoting and adjusting to being back at work without regulations. So that will be a bit more of our focus for our discussion today. We'll discuss best practices so our region's businesses can return to continue to operate in a way that's safe for your employees and patrons. We'll also include some information about the EEOC's recent guidance on offering incentives for employees to get vaccinated. And of course, we will continue to advance the effort to educate, motivate, and vaccinate the entire Northwest Ohio corridor, getting us closer and closer to that goal of 70% vaccination rate. Brandon, when it's your turn, I was just saying I can't wait to hear what that number is. We have once again assembled a panel of expert speakers to provide this update. And to introduce those is Terry Vanier, the Seminar Learning Manager at the Employers Association. Terry, take it away.
All right, Julie. Well, thank you so much, and good afternoon, everyone. Today, we are pleased to have back with us for this week's session, Brandon Palinski with the Toledo-Lucas County Health Department. Brandon has a Master's of Public Health, Veterinary Public Health from The Ohio State University, and has been working in the public health field since September of 2013. Brandon serves as the Toledo-Lucas County Health Department's Planning and Quality Improvement Administrator, leading the efforts to maintain public health accreditation status and driving quality improvement, performance management, and strategic planning efforts. Also with us today is Mechelle Zarou, partner with the law firm Shumaker, Loop & Kendrick. Mechelle has extensive experience representing companies in all areas of labor and employment law. She's also heavily involved in the Toledo community, where she uses her experienced voice to welcome and advocate for immigrants who enhance Toledo's economy and help create a vibrant Toledo. Mechelle is also an avid supporter of the arts and sits on multiple boards to keep Toledo artistic. She earned her BA with honors from the University of Michigan, her master's degree in English from Duke University, and her JD from Duke University School of Law. We also have with us Bob Bethel, Vice President of HR and Learning Services at the Employers Association. Bob's career in human resources has led him through a number of area organizations, and EA members tap into his extensive experience via our HR hotline and by engaging him for training and consulting projects. Bob's also involved in the HR professional community as a past director of the Ohio SHRM State Council, and in the local community as a Springfield Township trustee. We are honored to have each of you with us this afternoon, and we truly thank you for taking time out of your busy schedule to share your expertise with us. At this time, Julie, we'll go ahead and turn it back to you.
Thanks. I was a little bit delayed in getting this slide up there with our presenters on it. I was actually very excited to see the 38 pop up because that's well exceeded our registrations for today. So excited to have everybody with us. Before I turn it over to our panel, just a reminder to keep your microphones on mute to reduce our background noise. And this will be very conversational. So our presenters will have some great information to share, but feel free to put some questions in the chat, or when we get to the end, go ahead and raise your hand or speak up on those. So We are recording this session, as you all heard, and we will have that the link sent out to each of you. That'll go ahead and live on the Chamber's website, but I'll send that link out usually 24 to 48 hours, so give us a little time to get that prepared. And as we always say, this information is ever changing and ever fluid, so today's information is as of today, June 16th, that is our timestamp. So with that, I am going to unshare my screen, put myself on mute, and turn it over to Brandon.
Okay, we're going to see if I have mastered the sharing of the proper screen this time. So let's start there, and you should now see just the PowerPoint, right? Cool. Okay, welcome everybody. This information has been, as Julie said, very fluid throughout all of our sessions with the Chamber. I want to start today just kind of where we're at. As of today, we've had 43,321 cases in Lucas County. Very good news in that realm, however, is that since our last webinar almost a month ago, we've only had 650 additional. And coming from a state last year, late last year, where we were having 400 plus a day, to only have 650 over the past month is phenomenal. We couldn't be more thrilled with the trends that we're seeing. We have had 854 deaths in our community. Again, only 12 have been reported, but a lot of death data can lag. So this number may not represent the true state. Sometimes it can take weeks to months for some of that information to actually filter through. One really amazing number is our community positivity, which is down to 2.3%. It was at 6.5 on 5/19, which itself was pretty cool, but being at 2.3 is absolutely amazing, especially since that's based on almost 9,000 tests. It's not based on reduced testing. You still have a lot of those going on. And that is from about a week or two ago over a 2-week period. So that is great. If you do feel that you have the symptoms of COVID and you're not sure, even if you were vaccinated, we do have COVID testing sites still listed on our website at the link below on the slide. So it never hurts to possibly check up if you don't have any other possible cause for your illness, you weren't able to get to your doctor. If you just want to be sure, that is there. But we are seeing a tremendously reduced spread within our community, which is great. Just to illustrate that another way, these are the cases per day over the last 30. So you can see that even 2 weeks ago, or even 4 weeks ago, our previous 14-day, our average was 25 a day. We are right now under 10 per day average, which is the first time that has happened probably since last June, and that is not an exaggeration. So literally a year ago that we've seen this few cases at one time. We would like to say a lot of that is, we hope, due to the vaccination. I'm sure the warmer weather is helping. People are getting out more. They're not inside as well. So everything that we're doing, please keep it up. The trends are absolutely amazing. It's the best we've reported on at the Chamber so far. So that is always happy to say. Just to give you a look of where we've been again, since I show this every couple webinars, you can see in the beginning of April and May of 2020 is when we had our first peak. It calmed down into June. We had a sizable peak up in August, but then really the main disease burden that we saw in Lucas County was in November and December. And this is where we had a lot of days over 300 cases per day, at least 5 or 6 that were over 400 in a day. It was quite crazy to put it in scientific terms. What our community was dealing with at that time and what we were trying to keep up with contact tracing and all that. But as you can see, we came way down that peak towards the beginning of the year, a slight resurgence in April. And right now we are at that tail end where we're getting so few cases right now that we could not be happier about that. Well, we could at 0. 0 would make us happier, but we'll take what we can get at this point. In terms of the variants that you have undoubtedly heard about, these are our current numbers of what we've seen in our county. In most cases, I mean, these haven't changed dramatically. The UK variant has, but this is also based on passive sampling. So we don't necessarily get this data updated often from the state. I will say though that the UK variant, the B117, is pretty much the predominant strain in Ohio, as reported by the Ohio Department of Health last week. So that is what we see. It's also the majority of cases nationally. So that has become more or less the dominant strain. As many of you know, the majority of public health orders have been rescinded. The only ones that are really still in effect are for congregate living facilities, such as nursing homes, long-term care facilities, healthcare facilities, where you still do have to wear a mask in those situations in most cases and social distance. But otherwise, you will still likely be required to wear face coverings when you're on public transport, especially flying, and where local businesses do ask for you to wear that, or local ordinances. There are no local ordinances in Lucas County currently in effect, but if there were, that would be one of the things. But there are no more state masking or social distancing requirements. It is voluntary for all Ohioans. Quarantine and isolation does still apply. So if you do happen to test positive for COVID, or if you are exposed and are not vaccinated, you will still be need to quarantine or isolate, depending on which case, whether you were exposed or whether you were actually positive. There is some good news in that realm in terms of being vaccinated, which I'll get to in a moment, but that is actually codified in the Ohio Revised Code, Ohio Administrative Code. So any infectious disease, especially for Class A diseases, which COVID has been classified as, requires those. So while you don't need to mask or isolate, if you're sick, it's still prudent. Stay home until you know what that sickness might be, as a courtesy to your coworkers, as a courtesy to your friends. That really is one of the best practices we can employ to help avoid a possible uptick in COVID in the fall. We'll see what that looks like. We're hoping we keep seeing the trends we're seeing now, but it's very possible we might see an upsurge of cases just when we get into the fall and more people are indoors and congregating closely together again. In terms of why some of those state restrictions lifted, I did say this last time, but in a lot of cases, the vaccine studies that they're producing are showing that all 3 vaccines available in the US have a good deal of cross protection from those variants. It's probably one of the reasons why those variants haven't continued to cause an increase in cases, because most of them are more infectious, not necessarily causing more severe disease, but are more infectious. But still, we're seeing the cases going down, and it's, I would say, a big contributing part of that is the vaccination cross protection. Antibodies produced through vaccination seem to be a little more robust than your natural immunity in terms of those variants. And at least that's where some of the current literature is going and finding. So that's always a positive. If you have not been vaccinated, that's one of the biggest pros in my mind. The other is not having to quarantine, but just being more protected and being more assured that you're not going to be spreading it to other people is really one of the biggest bonuses. The state also reported last week that one of the reasons that happens is those who have been vaccinated tend to have lower viral titers in their blood. So even if you were to get COVID, the amount of virus that replicates in your body is going to be less, which means that you are going to be less likely to transmit it. Asymptomatic individuals who have been fully vaccinated are almost at, I don't want to say zero, it's never a non-zero risk, but you're at a very low risk of transmitting that if you are asymptomatic and fully vaccinated, even if you were to test positive for the virus. So it's always our plug to try to get as many people vaccinated as possible. So that's certainly one way. Spread less to others, protect yourself. You also tend to see less severe illness if you are vaccinated, if you were to contract one of the variants. And I think I have covered most of those pros sufficiently, so I'm gonna keep moving. We do still have gold standard preventative measures, even if they are not required by law. Obviously, for those who are unvaccinated, especially if you are sick or have symptoms of any sort, wear face coverings in public spaces, social distance where you can, especially from non-household members. Everyone should always be hand washing. It shouldn't take a global pandemic to hopefully reinforce that, but please wash your hands. If you're sick, stay home, consult your doctor, and then also support the public health efforts that will be ongoing: quarantine, isolation, calls from contact tracers, et cetera. In terms of vaccination in Lucas County, we are currently up to 45.8%, almost 46. We've given 16,000 vaccinations since the last update on 5/19, the last chamber webinar. And second doses, we've given 34,000 in that time frame. And that's not just the health department, but our community partners who are also vaccinating. So we are seeing a slowdown in vaccine numbers as far as the demand. Everyone who wanted it initially was able to get it finally. We do encourage individuals to please still get vaccinated, whichever vaccine is available to you. But if you do have a preference, you should not have much trouble finding what you actually want to be vaccinated with. In terms of what's available in our county, we have this schedule posted on our website of lucascountyhealth.com/COVID vaccine. We update it every week. From Wednesday on, you can see that we're at multiple sites. And in the beginning, you had to register for vaccine appointments. You still can register, but you can also walk in at pretty much any location, especially the ones we list. If it's one of the hospitals or a community partner hosting, you may want to register for those. But a lot of sites are walk in, walk up, get your vaccine, be on your way to a healthier year. We do also allow for businesses, if you want to hold a closed or open pod, basically vaccines on site at your place of employment, for your employees, for your customers, for the public. You could just do one for your employees only. We are happy to facilitate that. You can sign up by going to, again, our COVID vaccine page, and you'll see that purple drop-down bar. If you click on that, then there's a link to register just to tell us that you're interested in hosting a local pod. We still have the vaccine. We're still trying to get it out there. So if you think that it's right for you to do that, we're absolutely thrilled to work with you. Just fill that out or send us an email, give us a call, and we'll get you set up. And much shorter than some of the other chamber sessions. Everything's going in a relatively good direction. We'd love to see the vaccine numbers go up more, but in terms of our case count, everything is looking pretty positive at the moment for the summer.
Brandon, I did get a question directly. What is the health department requiring or recommending regarding quarantine guidelines?
So the health department, I'll take a step back. Sometime last year, I don't remember exactly when, the CDC revised its quarantine guidelines. And the gold standard is 14 days for quarantine. And the reason it's 14 days is because the virus has that incubation period in your body. If you were exposed anywhere from 2 to 14 days, depending on your individual immune system, conditions, all that, you would expect to see an infection actually develop. So the gold standard is that full 14-day period from exposure. Now, the CDC released 2 alternate pathways to try to make it easier for people based on the data they were seeing. So the first one is a quarantine of 10 days, which is the same as the isolation if you were actually developed the virus, with 4 days of symptom monitoring. And the other one, which was, it's a little tricky to wrap your head around, but you can quarantine for 7 days as long as you get a test not before day 5 and it comes back negative by day 7. So at the health department, we have never really agreed with that option. We do support the 10-day quarantine if that is more feasible. The 7-day one, while there's circumstances where people say, hey, the CDC said this, but we've seen enough of our own data, enough of our own cases to say that so many people get tested right before they actually develop the illness, and the test might come back negative, and then they're walking around and spreading it, that 5 to 7 days is really the average people do develop it. So we support the 10-day or the 14-day as whatever's appropriate. Some of the schools I know opted to keep the 14 when we made that endorsement of the 10-day as well. And really, that's where the health department stands on that.
Brandon, just to clarify, and you may have said this, but the 7 and 10-day guidelines there really only apply if people are asymptomatic also, right?
So, oh my gosh, yes, you are correct.
Yeah.
Because if you're in quarantine and you develop symptoms, then you go into isolation.
Yeah.
So that's the case where you have to remain asymptomatic for your, that would apply to the 14-day quarantine as well.
Right.
So that's such a like basic pandemic question. It just, whew, you almost stumped me on an easy one.
Yeah. And of course, the other guideline that they put out since then is, and again, I think you may have mentioned this at some point in there that today, but just to emphasize it, if people are fully vaccinated, even if they are exposed, then the CDC is at least saying that they do not have to quarantine that at that point, correct?
Correct. So if you are fully vaccinated, which is 2 weeks past your second dose of a 2-dose series, or 2 weeks past Johnson & Johnson, the 1-dose series, you do not need to quarantine if exposed to a positive individual, so long as you are asymptomatic. Right. Individuals who have COVID-like symptoms, regardless of vaccination status, should isolate and consider talking to your doctor or getting a test to confirm that you do or do not have it.
I did get another question come in, and this is also a good, since we're transitioning over to Mechelle here a little bit, because I'm not sure actually who should be answering this. Is it okay for businesses to do their own contact tracing, or should this be done by the health department? So there might be a legal reason why a business can or can't. So with that, I'll turn it back over to the panel.
So I'll take that first, and if Mechelle, you want to also jump in, that's great. The health department has to follow up on any Class A, Class B disease that's reported to us. So we do encourage businesses that if you do have a positive employee or you end up positive, you can certainly do your own internal contact tracing, say, hey, I was around this person, I was around that person, they should quarantine. And then you still will get that call from the health department just to say, hey, you were sick, who were you around, to try to make sure there's nobody that may have fallen through the cracks in that process. But legally, we do have to follow up on anything that's reported to us. So we encourage you to have that kind of process in place for your business, even though it may be less common or happening much less frequently now with the case numbers. And Mechelle, did you have anything to add there?
Yeah, I was just going to jump in there and say, I think the health department is best positioned to do it, and they should be, encouraged to contact the health department to work with them to do it. I think employers should be doing some level of contact tracing for the people who worked in the immediate area and make sure that if they need to quarantine, that they do so. And I think that's, I think that's necessary regardless of what the health department does. So I do think employers should be doing it, not to the extent of their personal life and who they encountered personally. That should be done by the health department, but just in terms of who in the workplace they may have encountered. Like, to me, I think that strikes the right balance.
And if an individual was home, like they did not work within 2 days prior to testing positive, we probably, in some cases, won't even call the employer because there was no workplace exposure there. Mm-hmm. So we would only follow up with them in their personal life at that point. But yep.
And in most of the cases I've dealt with employers, it's usually happened that the person was off work and then they were going to return and then they didn't, you know what I mean? So there was no reason to really question employees or notify them that there might have been an exposure. But it's best to have that procedure in place just in case there is a workplace. And we don't know for sure it occurred in the workplace, but we know if they've been in the workplace since the exposure. So that's what we go by. Do you want me to just launch in, Julie? Are there other questions? No other questions?
Yep, sorry, one just did pop in.
Yeah.
One did just pop in here. Can you hear me?
I can hear you.
Okay. Regarding quarantine and vaccinated employees, does the health department support not requiring quarantine if no symptoms for those vaccinated, or do they support the 14-day gold standard regardless of vaccination?
So if you're fully vaccinated, you do not need to quarantine at all if you have no symptoms. So even if you are exposed or anyone is exposed, like the person sitting next to me is tested positive for COVID. They were coughing, hacking up a lung. If I am fully vaccinated, I do not have to quarantine unless I also then develop some kind of symptomatic response. And I mean, at that point, that's when you'd want to get tested, talk to your doctor. I mean, maybe you just developed something incidental to it, coincidental, but that is when you would then isolate for 10 days from that date of exposure.
All right, the floor is yours, Mechelle.
Okay, great. Thanks, Brandon. So I thought I would update on a couple of different developments that have been going on at the same time. The burning question continues to be, should we as employers be mandating the vaccine? And we have a little more information now to answer this question. Many of you probably have read in the news, there was a lawsuit filed by nurses and certain other staff members at Houston Methodist Hospital in Texas. That employer was mandating the vaccine for all of their workers, and they have 24,000 employees, and most of them have been vaccinated. In fact, there's the plaintiff pool was only 116 employees. I've read 178, so the number may fluctuate a little bit, but that's a pretty small percentage of their overall workforce that actually participated in this lawsuit. And just, I think, yesterday or the day or just on the 12th, so 2 days, 4 days ago, the judge dismissed the lawsuit and basically in favor of the defendants and the favor of the employer and said, plaintiffs, you don't have a claim. And I think, it sounds like the complaint was pretty highly charged, talking about raising, that they're being treated like people in the Holocaust. And I don't think that really helped their case any, but they raised that and said that they were being forced into being, subjects in a human trial. And I think the judge, who's actually a Reagan appointee, so it doesn't seem to be, a political thing. The judge was just completely dismissive of all these arguments and said, no, this isn't coercion. You have a choice. You can work there, or you can work somewhere and get vaccinated, or you can work somewhere else and not get vaccinated. And ultimately the claims failed under Texas law because the employer wasn't forcing them to do a criminal act. And that's really the only claim they could have had, as if they were being forced to do a criminal act by the employer. It would have been wrongful termination. And so this lawsuit was shot down, and a key part of the argument was that the vaccine is experimental. It's not been fully approved by the FDA. And that's really why I was telling employers, maybe you should wait to mandate it until it has full approval. Well, the judge shot that down too and said, 300 million people have gotten the vaccine. It's been proven safe. It's not experimental. The emergency use allows the government to do this, and that's sufficient for the employer to mandate it. So that answered a lot of the questions, at least as to Texas law. There's still another case pending in New Mexico that there was a motion to dismiss filed, probably based on this case. And that remains pending. That was filed by prison guards at a government prison. That may come into a different result because that's a governmental employer and this was a private employer. So we have to wait and see how that works out. The biggest, I think the best argument that the plaintiffs had is the experimental status, but Pfizer has requested FDA full approval already. And I think Moderna is probably days away from doing that. I know that they're getting their application ready. So by the time the New Mexico case is probably ruled upon, those may very well be fully authorized. And likely the other vaccine manufacturers will follow suit. So it'll be interesting to see if that has an impact on the decision as well. So that still leaves us, should an employer mandate it? Personally, I still come out with, I don't think it's necessary. I think the voluntary system most of us have been doing has been working. And I think Brandon's data just proved that, we're way down in case counts. It seems like enough of the people are getting vaccinated that it's working. I think most employers have been taking the tact of really highly encouraging and incentivizing, and that seems to be working. But these two cases certainly are going to open the door for more employers to mandate if they think it's necessary to do so. The other thing that has happened at the same time is the EEOC updated its vaccine guidance on the specific issue of mandating. And again, confirmed, like you can mandate it, you can ask about it. None of that is a disability related inquiry. But what they did clarify is if you collect any information, documents, proof of vaccination, or maybe even an attestation that employees asserts that they're vaccinated, then those records are confidential medical records that have to be treated confidentially. It was kind of an open question before this clarification, only because if asking if someone's vaccinated is not a disability related inquiry, then why would the documentation that proves it be confidential? But the EEOC kind of just said, we don't care, it's still confidential, even though it's inconsistent. So employers can ask and they can collect those records as long as they keep them in the separate part of the personnel file where you keep confidential medical information, and as long as they don't, let just anyone have access, it should be accessed on a need-to-know basis. The EEOC guidance talks about supervisors having access to the information, and they can have limited access to the extent that they need to know to implement certain parts of your program, like to know who needs to wear a mask or not. The other key part of the EEOC guidance is on incentives, because I think a lot of discussion has been around, well, we want to incentivize our employees to get the vaccine. And the EEOC confirmed that they are okay, but they can't be coercive. So they can't be so much money involved that you really have no choice but to accept it. And they really want you to think more in terms of more de minimis types of incentives. So, things like providing information, providing access to transportation. It's interesting, they talk about just like giving them the information about where they can find low cost transportation or free transportation to get a vaccine. Didn't go so far as to say the employer could provide the transportation, but I think that would still be reasonable to provide the transportation. Things like, some PTO hours are probably okay. If you're giving away, bottles or keychains or little things, those are all fine. But when you start talking about real money and anything to me over $500 is probably going to be considered more coercive. So that's the EEOC guidance, and there wasn't really nothing overly surprising there, but it just helped to see it in writing. The other thing that the EEOC talked about is how to accommodate people who can't get the vaccine, whether it's because they're disabled or because they have a religious objection, sincerely held religious belief. And the EEOC guidance outlines how you assess this and says the first thing you need to do is determine whether an employee poses a direct threat. And you determine this by if they don't go forward with a vaccination. So you look at the duration of the risk and the severity of the potential harm and the likelihood of the potential harm occurring or how suddenly it will occur. And then from there, if they would pose a direct threat, if they didn't get the vaccine, then you have to look at accommodation. Can you accommodate them so they can still do their work? And the EEOC even says, look, you can accommodate in a variety of ways. First of all, by masking and social distancing, you can do different types of barriers. You can do all kinds of different accommodations up to the point of even reassignment. But they said reassignment should be an option of last resort. So to me, that's helpful, because I think a lot of employers wanted to reassign people who refused a vaccine, but they didn't know if they could. Or if they were unable to take the vaccine, they just want to move the people out of the place where they wouldn't be safe. And the EEOC is saying, if this is the best way you can accommodate, you can do that. The other thing the EEOC said that I thought was interesting on the accommodation front is that the employer needs to be alert to how employees who may be requesting an accommodation without really using that language, by just saying, well, I don't know if I can get the vaccine because I have this condition. Well, that should be a trigger for the employer to say, oh, this person is asking for an accommodation. And they want employers to train their staff who are going to be hearing those requests to actually understand that and offer the accommodation, and go through the process. They don't have to use the magic words. One thing they had in there that was kind of surprising to me is they mentioned kind of in passing that an employer cannot lawfully disclose that someone is receiving an accommodation. I would take issue with that statement. I don't know where that comes from, because there are a lot of reasons why employers have to say that someone's being accommodated. Like the supervisors have to know, sometimes the coworkers have to know, because they have to do their job differently. So that blanket statement from the EEOC was kind of strange and jumped out at me. But I would say limit that to people who need to know, right? And a lot of times people don't need to know who's getting an accommodation. One client and I worked out a system that I think is probably the best way forward and facing, you know, who's needing accommodation, who isn't, which is really just making it voluntary, that if people want to be able to be in the workplace without wearing a mask, then they have to show that they've had a vaccine. If they can't show that, or they don't want to show it, then they have to keep wearing their mask and social distancing. So it's almost up to the employee whether they present that information or not. But if they don't, they then have to continue with the mask and social distancing. To me, this is probably the best way to balance the competing needs. But, you know, you're still, if we're mandating that we want to know everyone who's vaccinated before they can remove their mask, then we're still in a scenario where we're going to learn about disabilities, and that's going to change how much risk is involved in terminations and other job actions. So making it up to the employee, like they can continue without telling you that they have a disability, you know, by just, if you make it voluntary and say, well, you can just keep wearing your mask and we never have to know. I actually think that's better for the employer and the employee, because they can keep their medical information private. You don't have to know as the employer, so you can keep making your decisions based on neutral factors. It's probably safer, and I can see Bob probably is going to comment on that when he's up next, because that's the key question to me is, are we opening the door to accommodations? And now we know this person has a disability, we have to offer accommodations in other areas. And, you know, is it just this big can of worms now, all because of whether or not the employee should mask? But you sidestep all that by making it voluntary. And then the other part of the EEOC guidance that I think is probably useful to know is there's the Genetic Information Non-Discrimination Act. And that statute prohibits employers and insurers from collecting information that would be considered genetic information under the act. And that includes like historical information about family members and their medical histories. And the EEOC said, basically, you can still ask if a family member has been vaccinated. We don't consider that genetic information under the Genetic Information Act, GINA, we like to call it, because there's no genetic information acquired when you're in asking that question. And even in the pre-screening questions that really were developed on a federal level, and everybody's been using the same pre-screening questions, the EEOC said flat out, all of those questions are fine. They are not considered to violate GINA, and they don't, there's not genetic information involved. But the one thing you can't do is you can't offer incentives for family members to get vaccinated. You can offer incentives to employees, but not to their family members, because that would somehow implicate genetic information of the employee, because now you have, I don't know, access to family history information. I thought it was a weird line to draw personally and confusing, but basically you can offer incentives to your employees, but not to their family members. That's what they're saying here. There was new guidance came out from OSHA, and the really detailed guidance that was issued this week was for healthcare entities. And I'm not going to go into detail on that because there's so much in there. But at the same time, they did kind of update their guidance for employers who are just private employers who are not healthcare entities. Just looking at this guidance, there was really nothing earth-shattering in there. The most interesting and significant part of the OSHA guidance is basically that it states right off, this only applies to workers who are not vaccinated or those who are at risk. Even if they've been vaccinated, they might still have the risk of developing COVID. So they're flat out saying none of these guidance or requirements apply to vaccinated workers. But otherwise, it was just talking a lot of best practices. Make sure you encourage vaccinations. They're saying give PTO or paid time off to go get vaccinations, encourage employees to stay home, keep doing social distancing, provide face coverings. Normally they've been saying employees should wear face coverings. This is kind of the first place I've noticed where they said employers should provide the face coverings. So that was a change. But for the most part, it's all pretty much all the common sense steps that we've been taking all along in the OSHA guidance. So it's out there, it's good for you to look at, but ultimately, I don't think it changed the ballgame very much. And it really kind of tracks the CDC guidance we got on masks not too long ago, where the CDC was saying, you know, vaccinated people can do more than unvaccinated people. So that's where we are. Best practices, I think, is to have voluntary disclosure for vaccines. You don't have to disclose unless you want to take off your mask, making sure we're doing accommodations and properly training staff to do that. And then giving all the accommodations using reassignment as the last resort. And then protect the confidentiality of all vaccine records. I would say that includes if you're going to have employees do an attestation that says, I've been vaccinated and I understand that I could be discharged if I don't tell the truth. Even that form itself, I would put in their medical file. I would not leave that in the regular part of their personnel file. I think those forms can be helpful because you're not worried about a card and whether they got a card from the doctor and is the card real or fake. It's just the employee saying, I promise to tell the truth and I'm telling you that I was vaccinated. And I think that's probably all you really need. And then finally on the incentives, you can offer them and you should, and make sure they're just not so expensive that employees find them coercive. That's all I have, unless there's some questions.
Great. Well, I'll just jump right in here, and thanks for that information. Great stuff, Mechelle. And I would tend to agree with you that in my experience so far in dealing with questions from our members and all the information that I've read, I think especially now at this time when the state is not requiring a mask of anybody, it doesn't really make a lot of sense to me to require people to disclose whether they've been vaccinated or not. In today's environment, because there is no mask mandate, if a company isn't going to require all employees to have a mask, I think it makes most sense to not ask about why, you know, if they are vaccinated or not, because it really doesn't matter, but just give them the choice. If they want to mask, they can continue to do that. And now at this point, you know, it really is not going to indicate whether they're vaccinated or not. It's just going to indicate that what their choice is, whether they choose to wear a mask or not.
Yeah, and I think just to add to that, Bob, I would not be asking employees why aren't they vaccinated. Right. You know, exactly. That's where I think employers can really get into trouble, and I meant to add that. So.
Yeah, and you're absolutely right. That has been very clear in all the guidance that I've seen is do not get it. The EEOC saying do not ask why they are not vaccinated. That's it, and I think that's probably very tempting for many people to do, right? To say, well, gee, why aren't you? And I think we probably have all had those casual conversations with people, and it's easy. We have to be careful, I think, not to get too casual about this and ask about that in the workplace, and just, you know, accept if somebody has decided not to get vaccinated, that's fine, that's their choice. But in where it gets a little tricky is in those employers, and there are still some that are choosing to require either require everybody to wear a mask. I did some training at an employer yesterday where we went there. I went there, as did Dave Tippett, and we were all employees are required to continue to wear a mask, and that's certainly somewhat a safe thing to do there. Also, both in terms of ultimate safety and still requiring the mask so that no diseases spread, but also safe in that you don't have to worry about whether you're going to offend anybody by asking if they have that they've been vaccinated or not, or no temptation to ask why they're not vaccinated, those sort of things. So some employers are still doing that, but I think it's probably a minority of employers that are doing that based on my experience so far. I think most of them are choosing to not ask and just allow voluntary mask wearing if an employee still chooses to do that. But one of the things that I wanted to point out, and it kind of ties into what you were saying, Mechelle, regarding that Texas case, that that case, and the EEOC has clearly said that that employers can require employees to be vaccinated. But I also understand that the Ohio legislature is considering some legislation right now that would prohibit companies from requiring a vaccine in there. So, which I thought was really interesting. I question, quite honestly, even if they did pass that, if that's going to hold up to legal challenges to do. And I'm no attorney. Let me make sure everybody knows I'm not an attorney. This is not legal advice. But I wondered, Mechelle, what you thought about that with that consideration of that law. Have you looked at that at all at this point?
Yeah, and it's interesting. I meant to talk about this, so I'm glad you brought it up. We at Shumaker, we have a lobbying arm of our law firm called Shumaker Advisors, and I was asking about the bills and how likely they are to pass. One bill that is likely to go through is that it prohibits governments from requiring vaccines. So that would be for public employers. That wouldn't apply to private employers. That one's likely to pass. But there's one that just prohibits requiring vaccines in all settings. And it sounds like the hearings on that kind of went off the rails a little bit. They claimed that the COVID vaccines caused people to be magnetized, and one of the nurses tried to stick her keys on her chest to show that she was magnetized, and it didn't work. So it kind of turned into sort of a carnival theater act. And then there was claims of it being tied to the 5G network and stuff like that. There was a lot of conspiracy theory kind of elements to the hearing. So it doesn't sound like it's going to go through, and the governor actually opposes it. So I think we'll see the one where the government entities won't be able to mandate, but I don't know what will happen with the other bill. That sounds like it went a little strange.
Yeah, it does sound common. And I agree. I think that makes a lot of sense. I don't think that the government should require that, but again, I think I guess just to go back to that lawsuit that you pointed out there, that the employer is not requiring that they be vaccinated. They're just requiring they be vaccinated in order to work at that particular employer.
Exactly. And they tried to bring in the Texas case an allegation that was, a wrongful discharge against public policy, but Texas doesn't actually have that kind of a claim. In Ohio, we do have that type of claim. Where you could have a wrongful discharge if you are terminated because you did something and that whatever it is that you did was, the employer's discharge of you was against public policy. So like a classic example of this is a whistleblower type situation where you were trying to oppose an unlawful action and your employer fires you. They say, well, that's against Ohio public policy. I think that would be a tough claim here under our law when it comes to mandating vaccines, because that's generally a public good, not, and they're requiring you to do a public good, not a bad act. They're not firing you, interfering with you because you're opposing a public good. It's so weird, it's just backwards. But ultimately, I don't think that claim would go through in Ohio. I just don't see how it really violates an Ohio public policy to mandate vaccines. And interestingly, there are other Ohio statutes that permit vaccines. So like for public school children and different things and college kids. So it's hard to, how is that a violation of public policy if it's already in our public policy that you can mandate vaccines, right?
Right. Yeah, and that's going to be the interesting thing about this whole thing. Even with, as you say, you expect the one law to pass that doesn't allow governments to do that, but there are those others that, and again, I'm getting into territory that's a little foreign to me, but you know, I know that there are other vaccines, as you mentioned on there, that are required to go to school, you know, and that's being required by a government. So it'll be interesting to see how that works out.
Right.
So one other question I wanted to point out from a member that we had that we received was they have an employee that this company is continuing to require everybody to wear a mask, and they had an employee come forward and request an exemption from wearing the mask because of anxiety that it caused that particular person. So certainly could be considered a disability in that case, and so it was sort of asking for an accommodation there. But from what I've read, in my response was that not wearing the mask is probably not a reasonable accommodation in that case, because if it's part of their policy and they're doing it to try to protect their employees, that it probably not wearing the mask is not the thing that they would have to do. But they may try to change the job to minimize exposure to other employees, or to only make it required during certain times when he may be interacting with other employees. Those kind of things, or even working from home, seem like a more, depending on the position, might be a reasonable accommodation rather than to not wear the mask. So I don't know, any thoughts on your part, Mechelle? For that?
I mean, I think those are the tough questions. And one of the things that we initially tried for that, specifically for that situation, was like a clear face shield. Mm-hmm. And we thought that might be a good alternative, but then the CDC came out and said that's not as effective as a mask. And if you're going to wear a face shield, you need to wear a mask underneath it. So that kind of like blew our attempt to use it that way. But I agree, just saying you don't have to wear a mask is not a reasonable accommodation. I would look more towards, are we able to distance this person and put them in an area where they could work alone or separate so they didn't have to wear a mask, or reassign them, change their shift, you know, whatever. And then remote work, you know, if that's a possibility too. But yeah, those are the tough questions that we've been dealing with all this years, you know, with all the phone calls, you know.
It's interesting that you just mentioned that one, because a question did just come up as you were in that conversation. What are the panel's thoughts about continuing remote work as an ADA accommodation? And so you've touched on that a little bit, but if there's anything to add to that, but also sort of in that same note of question, curious on the panel's thoughts about using the honor system when it comes to wearing masks in the workplace. Mm-hmm. For example, should employers verify staff are vaccinated, or just trust the employees not wearing them are in fact vaccinated? So I think throughout we've kind of touched on a little bit of those, but if you've got something for this question, that would be great.
Well, I'll start and then I'll let Bob, you know, add his comments, but ultimately the EEOC guidance does mention remote work as a reasonable accommodation. And I think where it's feasible, it should still be considered as an accommodation. The question is, where is it feasible? You know, if you have people who are on a manufacturing line, that's obviously not an option. So I would still consider it as part of one of your attempts to reasonably accommodate if it could work. As far as the second question, which was honor system, I think I wouldn't totally I think I would make a strong statement if I were going to go that route. I mean, I think you could do it that way. But I think you would make the strong statement that these are our expectations. We expect that if you're not wearing a mask, it's because you're vaccinated. And that, you know, if we learn later that you were not vaccinated, then we may take steps. You know what I mean? Kind of more of a stronger statement than just let them do what they want and see how it works out. Is probably for the best, because, you know, in any situation, you're going to have abusers or people who are not going to follow the rules exactly. But at least if you set the expectation that there will be consequences if we find out you're not being honest and you're not being truthful about your status, that could help.
Yeah, and for me on that, I think it depends on the stance that the employer takes about mask wearing in the first place. Mm-hmm. Because I think it's very clear with the guidance that employers can have a policy that says if you are not vaccinated, we expect you to wear a mask. you know, but then on the other hand, in that case, yes, I agree that if that's the stance that the company is going to take, then I think it's wise to require some documentation, some proof that of who's vaccinated and who's not. However, if the company's stance is the Ohio guidelines say that nobody has to wear a mask now, so we're not going to require a mask. We don't care whether you're vaccinated or not. You don't have to wear a mask here. You can choose then to wear a mask if you want, and that's fine. Nobody has to know one way or the other. So again, I think it depends on what the company policy is regarding mask wearing to determine whether you ought to. I guess in my opinion, if you say we're going to follow the Ohio guidelines, then the honor system doesn't mean anything. There is no honor system because it doesn't matter. Nobody has to wear a mask.
Right. The guidelines are different now. That makes sense. Yeah. I agree with that.
Yeah. Yeah. So, so hopefully that answers the question. But I agree in the first part of that, working from home, reasonable accommodation. Well, I had a similar question to that here recently, which I thought was really interesting. That person had been working from home for 11 months, came back to work for a couple months, but then just provided a doctor's note that says, hey, this person needs to work from home because of medical issues. And so that one gets a little bit tricky also because it'd be really hard to argue, I think, that working from home is not a reasonable accommodation. They've just done that for the last 11 months, right? How can you argue that you can't do that, that it's an undue hardship for the company? But in this particular case, my recommendation was because the note from the doctor was very general. And as I looked at the EEOC guidelines, it appears to me that you can ask for clarification on that. Okay, why is this necessary? And then determine if working from home is a reasonable accommodation or not.
And you can do that generally when someone requires an accommodation. You can get more information. It's not like you're limited to the form, the FMLA form. In FMLA, you're just stuck with what's on the form. But in the ADA setting, you can get more information. I use a form that has the doctor specify, what's the disability, how would the disability be helped by the accommodation the employee is requesting, any other ways that this employee could be accommodated, things like that. And I recommend doing that for sure where the information is vague. But we're going to have a real problem with the work from home thing because prior to COVID, there were cases that said work from home is not a reasonable accommodation in all settings. But, there was one case that came out that involved an attorney that said that is a reasonable accommodation for an attorney because the work could be done from home. But it was very clear in saying that may not be the case. This is not just to say remote work is available to everyone. Well, the world has changed a lot. Yeah. We're going to see we're going to lose that as a defense, and it presents its challenges.
Yeah, I agree. So, yeah, I had one last question. I might ask of Brandon if that's all right with you, Julie. Yeah. Brandon, have you heard anything about any update on whether the CDC or anybody thinks that that a booster shot is likely to be required in order to maintain the vaccination status?
Bob, I had that same question just asked. So
great minds think alike, Julie. There.
So it's not a straightforward question to answer just because immunity is such a complicated topic. That's why the CDC erred more on the side of caution for natural immunity for those who did have COVID, saying that for 3 months, we're pretty sure you're absolutely not going to get it again. You're not going to spread it. But if you're beyond those 90 days from your first infection, then we're going to consider it a reinfection. And then you'd need to quarantine or isolate again, depending. So immunity is complicated. They have not put any kind of timeline on vaccinated immunity. I think they're seeing that it's a little bit more robust, but again, there just hasn't been enough time since vaccines started to know that completely. In terms of a booster, if the case trends continue to drop nationally, which I mean, they are in most places just starting to go down, I don't know that a booster would end up being required. It's always a possibility if there becomes a new variant that happens to cause more severe illness and spreads easy. They might say, well, you might want this booster to help protect against that variant. But it's one of those things where you simply are going to have to wait and see. And even then, it might just be a recommendation. It's not a you need the booster, but we recommend you get the booster. I will add too, just from the discussion earlier, for those employers who are considering requiring proof of vaccination, if an individual does lose their vaccine card, they can contact the health department and we will verify that the individual is vaccinated and issue a new card. And you can do that by calling in our main line, which is 419-213-4100, and then pressing option 1 to reach our COVID call center. So right now that is that process. You also could do our contact us through our website and you'll get directed to the right person eventually, but that is an option as well if you do lose or something happens to your card.
And is that the case even if they didn't get vaccinated through one of your sites, even if they were through an on-site clinic with their employer?
So there might be circumstances where we can't verify it, like if they were vaccinated in another state or something like that. Some of those records we can access, but generally speaking, if you were vaccinated in Ohio, we should be able to see if you were vaccinated or not. It's especially true if you only got one of the doses from us. We'll be able to know that you got one from us, you got one from somebody else, that's okay. But we would certainly let them know that we can't verify, you should check up with so-and-so or call the local health jurisdiction of where you did get vaccinated for that record if we cannot find it in the state system.
That's very helpful, thank you.
All right, we are at 1 minute after, but I did just have one question come in that truly is just clarification to make sure that that we heard correctly. Ohio does not require a mask for anyone regardless of vaccination status. Correct.
There is no mandate that anyone must wear a mask. It is still recommended, but there's no mandate.
But like a retailer or something at a store could say, please wear a mask if you're coming in, sort of like no shirt, no shoes. They still can do okay.
Yeah, so, private employers or business owners can set their requirements, yeah.
Very good.
Thanks so much.
Yeah, I have had no more questions come in. Bob, if you have anything else?
Nope, I think I'm all good. Thank you.
All right, sounds good.
Thank you.
Well, once again, everybody, thank you for joining us, and thank you to Bob, Mechelle, and Brandon for your excellent information and conversation. I always get so much out of these. Again, we did record this session, and everybody who registered to the email that you gave us, we'll go ahead and send that link to you when we've got it ready to go. So take care, stay safe, and have a great afternoon.
Thanks for having us.
Yep,
thank you.